Hi, my name is Thomas Wright. I'm a plastic and reconstructive surgeon here at Logan Health. So my role as a plastic and reconstructive surgeon is to improve form and function of my patients, and typically this is after people go through a traumatic experience or go through a cancer resection that leaves them missing soft tissue in certain areas of their body. My practice is largely reconstructive, but in addition to purely reconstructive patients, we also take care of people with large breasts who would benefit from breast reduction, as well as people with too much abdominal skin. Maybe they've lost a lot of weight. We can do something called a paniculectomy to remove the skin that hangs down after massive weight loss. We take care of skin cancer reconstruction, particularly if it's on somebody's face, which is pretty valuable real estate. And my practice so far has been purely reconstructive, but we're planning to increase a cosmetic portion of the practice too in the future. So microsurgery is a technique that utilizes a microscope to re-anastomose, or put together, an artery and a vein to transplant tissue from one body location to another location. And it's right now kind of the pinnacle of reconstructive surgery. There's nothing you can't reconstruct if you can perform reliable microsurgery. And any microsurgeon can do all sorts of other forms of reconstruction, but having microsurgery as a tool in your toolbox really gives you the flexibility to reconstruct most areas of the body. Microsurgery is a way to do something called free flaps, where you're completely unplugging a portion of somebody's soft tissue or bony tissue and replugging it in using the microscope. And times when this is important or necessary are times when, somebody has devastating lower extremity trauma and they're missing a lot of soft tissue to their lower leg. You can bring tissue from their thigh to reconstruct and save their leg from an amputation. Another common time that we use microsurgery is for breast reconstruction, and we can transplant patients' abdominal skin and fat onto the chest to reconstruct their breast after mastectomy for cancer. The benefits of microsurgery for breast specifically is to avoid implants. Implants are a great reconstruction for many patients, but they do have certain downsides. In particular, if patients undergo radiation of their chest wall, the radiation does a great job of treating the cancer, and it's very important, but it also causes difficulty with healing, and when you're trying to heal the mastectomy skin over an implant, sometimes there's issues if the patient's been radiated. In those cases, having a tissue-based reconstruction is very advantageous because the tissue we're bringing in to reconstruct hasn't been radiated. Some women also opt for what's called autologous reconstruction, or flap-based reconstruction, just because they don't want to worry about having implants for the rest of their lives. They're foreign bodies and the implants might move around, they might rupture, you can get dense scar tissue around the implants, and with a flap-based reconstruction you avoid those potential complications. My referrals for this type of procedure are usually coming from the surgical oncologist, and here in Kalispell that would be Dr. Kaptani, and she does the mastectomies and treats the breast cancer in this community. So a lot of my referrals are coming from her. I do get a lot of referrals from other plastic surgeons that aren't doing micro reconstructions. And we can easily just set up an appointment to discuss if this would be a good option for any patient that might be interested. Patients that qualify for the procedure have had a mastectomy and they desire breast reconstruction, and for whatever reason they may not be interested in implant-based reconstruction.